you're treating in autism is not autism. You're treating the symptoms, language delay, ADHD symptoms, GI problems, medical issues. So there's really no treatments that treat core symptoms of autism very well out there at all. So yeah, so like if even if they don't get the autism diagnosis, if they get a speech language disorder or delay, or if they get an OT, whatever, you're going to start getting the right therapies to address those. That's the simple answer. The more complex answer, though, is the real world. Autism diagnosis does open doorways to specific kinds of services that are more geared towards autism, like ABA therapy and others, that in some states and insurance companies won't give those without the autism diagnosis. And even worse, even without the right kind of the certain tools to be used to find out if they do have autism. There are a lot, that's, by the way, completely unfair in terms of mental health parity, and it's actually illegal, and there are legal recourses to it, but because you shouldn't have to prescribe a certain type of therapy for a certain disorder. ABA could work for any kid, basically. So the more complex the answer is, yeah, it is actually helpful to get the more accurate diagnosis eventually, and faster, because we do know, because of plasticity and other things, the earlier we can get the diagnosis and get kids into treatment, they tend to have better outcomes and do better. So.